So thank you to everyone who's joined us today for the Mental Health Proclamation. I want to thank my colleague, Councilmember Albornoz, for leading on this and doing such amazing work as chair of our Health and Human Services Committee. As many of you know, this year as council president, one of the things that I have really tried to do is highlight and move forward our work on mental health here in the county. We know that during times of crisis, many times people think about their mental health and wellness. But it's really important that we start thinking about our mental wellness all year round, just like we think about our physical wellness. And so raising awareness, breaking down that stigma is really important. The other thing we know is that when we hear from all of you folks who are doing amazing work and members of our community, is that we are such a resource-rich county and have incredible people working on these issues. Unfortunately, sometimes families don't always know about what is available to them in individuals. And so some of the work we're trying to do is bringing people together, identifying where the gaps are, and really supporting those who are doing this work in our county government and with our nonprofit providers. We also know that as a profession, this is a difficult one. There are a lot of challenges that we are facing, that we were facing before the current federal administration, and now those have been exacerbated by policies and changes coming down from the federal government. And so we're also here to support each and every one of you in your work that you're doing, because your mental wellness, the stability of your work life is so important in order to help our community. And so with that, I'm going to turn it over to my colleague, Councilmember Albornoz.
Well, good morning, good people. It is wonderful to be here today, and we can't talk about health without discussing mental health. And I do want to acknowledge and thank the leadership of our council president, who, as she just mentioned, has chosen to make this her policy priority as council president this year. We had a fantastic summit that was held at the East County Community Recreation Center just a few months ago, where we heard from not just government providers and county providers, but also our nonprofit providers and our private providers, acknowledging that we are all in this together. As the council president mentioned, the changes that are happening at the federal level are intended to be disorienting. They are intended to be cruel. They are intended to impact our mental health, particularly those of our most vulnerable populations. And the only way to combat that and to get us through these next several years is to make sure that we are doing everything possible, whether it be policy, whether it be supporting programs and services that we know are working, whether it's creating time and place for us to create more meaningful collaboration and partnerships. I learned a long time ago that we all can't do everything, but each of us can do something. And in the case of mental health, we can each do a lot. But it starts with ourselves, taking care of our own mental health and that of our families and that of everybody immediately surrounding us. And so we stand here today recognizing the importance of mental health and the awareness of it, but we're all very aware right now that our mental health is being impacted. But it's proclamations like this, it's events like this that give me hope that brighter days are ahead. We have a very large group. Normally, we go around and have everybody introduce themselves, but in the spirit of wanting to make sure that we're able to get things going, we're going to ask everybody to just your name and the organization you're with, and then we will be hearing from Dr. Keisha Davis.
Pamela Saunders, Crisis Center, Montgomery County Crisis Center.
Beth Tabachnik, Crisis Center.
Quincy Inman, Cornerstone, Montgomery.
Larry Epp, Shepherd Pratt.
Teresa Martucci, Advanced Behavioral Health, Outpatient Mental Health Clinic.
Cameron Pondexter, Prevention and Harm Reduction Team.
Sean Latanzia, Local Behavioral Health Authority.
Jenny Stepanek, Maddie Stepanek Peace Foundation, and Up County Community Resources and Main Street Connect.
Stephen Murphy, Department of Corrections and Rehabilitation.
Jen Lynn, Up County Community Resources.
Ben Stevenson, Prevention and Harm Reduction Services.
Victoria Caprillion, Be the One Youth Ambassadors.
Lahan Tesfai, Be the One Youth Ambassadors.
Leah Kissin, Be the One Youth Ambassadors.
Kimberly Fogg, Global Sustainable Partnerships, and Vibe Checkup, the power of checking in.
Vera Kurdian with Advanced Behavioral Health.
Thank you. Celia Sorkin, Montgomery County Federation of Families for Children's Mental Health, and the Mental Health Advisory Board. Council.
Mindy Pierce, Primary Care Coalition, Nexus Montgomery Regional Partnership.
Monica Martin, Montgomery County Department of Health and Human Services, Behavioral Health and Crisis Services.
Keisha Davis, your County Health Officer.
Megan Westwood, Maryland Treatment Centers.
Avital Graves, Montgomery County Fire and Rescue.
Katarini Stepanidis, PCC, Nexus Montgomery Regional Partnerships.
Blanca Cuervo, also Primary Care Coalition and the Montgomery Cares Behavioral Health Program.
Dornay Hill, HHS, Behavioral Health and Crisis Services.
Sharon Dici, NAMI Montgomery County.
Karishma Sheth, Every Mind. Dr. Christina Chester, Montgomery County Public Schools, Psychological Services.
Irina Polikova, Summarize DHHS Intern.
Ivy Carter, Summarize DHS Summer Intern.
Carrie Guthrie, Cornerstone Montgomery.
Megan O'Brien, Every Mind.
Evan Langhold, Every Mind.
Braylon Wood, DHHS Intern. Shyla Agarwal, Summarize DHHS Intern.
Alejandro, Summarize Intern at DHHS.
HHS, Latino Health Initiative, Ingrid Lizama.
Caroline Jung, Every Mind.
Mary Lee Sortor, DHHS Intern. Haiti Captcha, Summarize Internship.
Libby Nealis with Shepherd Pratt and the Mental Health Advisory Committee.
Lori Garibay Aquino, HHS Children, Youth, and Family Services.
Mariana Serrani, Latino Health Initiative.
Roberto Garza Rodriguez, Latino Health Initiative.
Thank you. You guys crushed it. We will now hear from Dr. Davis.
Thank you, thank you. Good morning, everybody. Thank you, Council President Stewart, Councilmember Albornoz, and to the entire County Council for this important proclamation recognizing Mental Health Awareness Month. I would also like to recognize our DHHS Summarize interns who are here with us this morning on day 2 of Summarize. As Councilmember Albornoz mentioned, mental health is health, just as critical as our physical health, and it touches every person, every family, every neighborhood in our county. And yet too often, stigma keeps people silent. Today we say it's okay to not be okay. Talking about mental health is a sign of strength and not weakness. Our young people, many of them who are here today, especially are facing unprecedented levels of stress, anxiety, and depression. And as a community, we must create safe spaces for youth to speak up, seek help, and be heard without judgment. We also recognize that mental health challenges do not affect all communities equally. Communities of color, LGBTQ+ individuals, and other minoritized groups often face added layers of trauma and fewer pathways to care. We must work to change that by advancing culturally affirming, accessible services for all. I'm proud to work with our behavioral health team and the surrounding community, again, many of whom are here today, in supporting those with mental health challenges. And we know that there is still much more work that needs to be done. Together, we can break the silence, break the stigma, and build a healthier, more compassionate Montgomery County. Thank you.
Next, we will hear from Monica Martin, who will also introduce a few other important guests.
Good morning. You're going to hear me very quickly touch on some things I've already been touched on and that they're repeating. That's what today is about. So it's such an honor to be here today with so many dedicated behavioral health leaders, everybody here, community partners, and residents who recognize the importance of mental health awareness. As we've already shared, mental health touches every corner of our community, whether it's a loved one, a colleague, a neighbor, or ourselves. It impacts each and every one of us, and that's why each and every one of us play a critical role in where connection, support, and healing are possible. So I want to thank Council President Stewart and Council Member Albornoz and HHS Chair Albornoz for their leadership really every day, but especially today, in issuing this proclamation as a public reminder that mental health is health. It's already mentioned several times. It is health. It's part of our overall health. It's just as vital and inextricably intertwined with our physical health, our spiritual health, and our whole community health. And again, that your health is a sign of strength, weakness. It's not to believe this shared. But you need to be absolutely clear about the fact that awareness is only the beginning. All of us here need to make sure that we're moving towards action each and every day. So along those lines, I introduced a couple of guest speakers, and I'm very excited to have them come to the Lanford with you. With a reminder as they're speaking. Did I turn it off?
Okay, I'm going to start over. I'm kidding. I'm not going to start over. So bottom line is we have a charge here together to keep building systems of care that are accessible, culturally responsive, and rooted in dignity. The havoc that's being created in our community is preying upon those who were already experiencing discrimination, economic insecurity, and instability in general. And we have some leaders here today that are going to share with you their stories of leadership in community organizations and leadership in schools and with their peers that are doing something about this. So without further ado, I want to introduce Vera Kurdian, CEO of Advanced Behavioral Health.
Good morning. Thank you for that introduction. What an honor to be here today, to be part of the Mental Health Awareness Month through this proclamation. We know, just like people before me had said it, mental health is not a privilege, it's not a luxury, it's a necessity that every community must have. We know that people suffer in silence and they carry invisible pains and struggles that we don't usually see. It's extremely important for us as mental health providers, community leaders, to be able to walk with them through this journey. Being a community resource here in Montgomery County, which we are very privileged to live in Montgomery County, to have those resources, is to be able to offer support and help to our families. One of those services that we currently are offering is targeted case management, which is extremely important to our families. It's a service that is not just for the youth, it's for the entire family. We will be able to walk with them through their struggles. We will be able to support those families when they have children that they don't know what to do. Through partnering with our community partners and other community providers, we are able to do this very important work. So this month is a reminder that we all as community leaders, providers, community members, we must come together and support our communities, because if we want a better future, we must invest in our youth, we must invest in our families, regardless where they come from and what they speak and what they do. So it is an honor to be here. Thank you so much for this opportunity, and what a great day to be here in Montgomery County, to be able to make this a proclamation of mental health awareness. Thank you very much.
Thank you, Dr. Kurdian, for the reminder that we really must be intentional, right now more than ever, in standing together to support resilience, protect essential services, and advocate for policies that promote well-being for all. You know, here in Montgomery County, we are working every day to break down stigma, to expand services, and to invest in prevention, intervention, crisis response, and recovery supports. And we couldn't do that without the incredible partnership and expertise of so many of you in this room and beyond. It's now my distinct privilege to introduce our young leaders that are going to lead us forward in this charge. These Be the One Youth Ambassadors are motivating other students to lead peer-led initiatives in Montgomery County schools and the community and beyond. So please come up, Vicky Caprilian and Leah Keeson and Lai Tesfaye.
Good morning, everyone. My name is Leah Kissen, and I'm a rising senior at Winston Churchill High School.
I'm here today not as a student, but as a peer, a friend, and as someone who understands the quiet battles that many of us are fighting. I'm here to talk about something incredibly important, something that affects every single one of us, whether indirectly or directly: teen mental health. Let's start with some numbers, because numbers don't lie. According to the CDC, in 2021, more than 40% of high school students reported persistent feelings of sadness or hopelessness, a significant increase from decades prior. Think about that. Almost half of the teenagers you know could be struggling, including maybe yourself. And it gets even more alarming. The Trevor Project's 2023 National Survey on LGBTQ youth mental health found that 56% of LGBTQ youth aged 13 to 17 reported seriously considering suicide in the past year. These just aren't statistics. These are our classmates, teammates, siblings. These are us. These numbers paint a stark picture. Our generation is facing a mental health crisis. But why is this so important for us to address? Because mental health is not separate from physical health, as stated before. Mental health is health. When we ignore our mental well-being, it impacts our everyday lives. It impacts our ability to learn, to form relationships, to thrive, find joy, and build a fulfilling future. How can we be expected to thrive academically, pursue our passions, and become contributing members and successful members of society if we're constantly battling issues like anxiety, depression, and just constant stress and burnout, and other mental health challenges in silence?
Hi, my name is Lahan Tesfai, and I'm a rising junior at Winston Churchill, and I'm 16 years old. Following what Leah said, that silence brings me to the next point, the stigma. For too long, talking about mental health has been seen as a weakness. For too long, we whisper about therapy and we hide our struggles from fear of being labeled or judged. This stigma is a heavy chain preventing us from reaching out for help when we need it most. It tells us, just get over it or toughen up, when what we really need is understanding, empathy, and professional support. Imagine if we treated a broken arm with the same dismissal. Just walk it off sounds ridiculous, doesn't it? Yet we do this all the time with mental health. We need to break this cycle. We need to normalize conversations about feelings, about stress, and about seeking help. Speaking up isn't a sign of weakness, but a profound act of courage. So what can we do? How do we move from these concerning statistics to a future where teen mental wellness is prioritized? The answer lies in providing opportunities for us as teenagers to actively promote mental wellness. This means more accessible mental health resources in schools, not just a counselor who's overwhelmed, but a robust system of support, including peer-led programs. It means integrating mental health education into our curriculum, teaching us coping mechanisms, emotional regulation, and how to identify signs of stress in ourselves and our friends. It means we have to create safe spaces where we can openly talk without fear or judgment, whether that be clubs, support groups, or mentorship programs.
Good morning. My name is Victoria Caprillion, and I'm a rising senior at Winston Churchill High School. This also means empowering us to be part of the solution. When we have opportunities to design wellness initiatives, to lead peer support groups, or to share our stories, we become advocates for our own generation. We understand what our peers are going through, and we can connect with them in ways that sometimes adults cannot. Imagine student-led workshops on stress management, mindfulness breaks incorporated into the school day, or creative outlets like art or music used as therapeutic tools. These aren't just feel-good activities. They are vital interventions that build resilience and foster a culture of care. We are the future, but we are also the present. Our mental well-being is not a luxury. It is a fundamental right. By acknowledging the scope of this challenge, by actively working to reduce the stigma surrounding mental health, and by providing meaningful opportunities for teenagers to promote wellness, we can build a generation that is not just academically successful, but emotionally strong, resilient, and equipped to navigate the complexities of life. Let's turn these statistics around. Let's create a world where every teenager feels seen, heard, and supported. Let's start the conversation, extend a hand, and build a community where mental health is not just talked about, but genuinely cared for. Thank you.
Okay, I needed that. That was extraordinary. Excellent, excellent job. I also want to give a shout out to my chief of staff, who happens to be a clinical licensed social worker herself, Beth Schumann. All right, we're going to now read the proclamation. The County Council of Montgomery County hereby proclaims, whereas mental health is a vital component of overall health and well-being, profoundly affecting individuals, families, and communities across Montgomery County, and
whereas mental health encompasses emotional, psychological, and social well-being, influencing how we think, feel, and act, as well as how we handle stress, relate to others, and make life decisions, and
whereas despite the widespread occurrence of mental health conditions, stigma and misunderstanding continue to prevent many people from seeking the help they need, and
whereas Mental Health Awareness Month serves as an annual observance to underscore the importance of mental well-being, educate the public, reduce stigma, and promote access to care and community support, and
whereas 1 in 5 adults in the United States experiences a mental health condition each year, and 1 in 6 youth lives with a mental health condition, yet only half of those affected receive treatment, and
whereas early intervention and access to high-quality, culturally competent care are critical to managing mental health conditions and improving quality of life, and
whereas Montgomery County's Department of Health and Human Services, Fire and Rescue Services, Police Department, and essential nonprofit partners continue working together to strengthen our behavioral health crisis responses system, enhancing access to services such as the 988 Suicide and Crisis Lifeline, mobile crisis and outreach teams, and crisis stabilization centers, and takes home.
whereas recognizing that mental wellness is foundational to workplace productivity and satisfaction, Montgomery County has earned national recognition for 3 consecutive years for its holistic wellness programs, comprehensive mental health benefits, and commitment to a supportive, stigma-free work environment. Now therefore be it resolved that the County Council of Montgomery County, Maryland affirms its continued dedication to advancing mental health awareness, reducing disparities, and supporting the well-being of all residents, hereby recognizing a belated acknowledgement of National Mental Health Awareness Month, and be it further resolved that we encourage all residents to prioritize their mental health, seek help when needed, and support each other in this process. Presented on this day, the 24th of June, 2025, by Councilmember Gabe Albornoz and myself, Kate Stewart. Thank you, everyone.